Very good morning, my dear students. Welcome to the second professional year of AETCOM module. We will be starting this year's module with the first topic of Principles of Communication, second part. Myself, Dr. Yatish Kumar Joshi, PhD scholar, Health Profession Education, JNMC Wardha. Under the supervision of Dr. Sunita Vaga, Head of the Department of Pathology, JNMC Wardha. So in this session, we will be covering the topics. What is discussion? Its types and steps. Patient-centered discussion and its steps. Opening of discussion, listening, gathering data, and concluding. So let's begin. What is discussion? Discussion is an exchange of views for the purpose of exploring a subject or deciding an issue. In general, the steps of discussion are elicitation discussion, data discussion, explanation discussion, and consolidation discussion. So what is elicitation discussion? Prior to instruction or at the beginning of a new unit or a new patient or a new event, we uncover the participants' prior knowledge and experience. This increases the awareness of their own relevant ideas and experiences. It helps to expand and broaden the ideas by listening to others. That is, we probe into the basic knowledge of the participants. Next is data discussion. After data collection, we connect the investigation question and the data, grapple the discrepant and anomalous data, identify data that can serve as evidence to support a claim, and link the data to the representation. That means after we collect the basic information of the patient, then we collect the actual systemic or the disease related information. This disease related information is then combined and the evidence of it is identified and it is linked to the knowledge of the or the doctor, which helps to give a further explanation to the patients. Then is explanation discussion. Based on the previous steps of data collection, data discussion, we do explanation to the participants. We build on the data that we have collected is data analysis. Point to the evidences and explain the reasons that justify or support a claim. Describe a scientific principle or a reasoning that explains the findings. Then after we explain the problem and the probable possible outcomes or possible treatments to the patient, we combine the complete discussion into one summative part, that is consolidation discussion. At the wrap up of an investigation or when connecting to one that follows, we ensure that everyone can describe what they did it, why they did it, and what they found out of it. We replicate what a class did in words, including giving a rationale for their methods and describing their findings. So this is in general. The same applies on our discussions with the patients in clinical scenarios. So next, what are the types of discussion? The discussions when taken in a group can be of two types. One is a one-way discussion, second is a two-way discussion. Another classification can be a competitive discussion and a cooperative discussion. If we notice, in one-way discussion, there is discourse and diatribe. In discourse, it is a one-way and a cooperative discussion. Purpose is to deliver information. It is like a lecture or like a seminar. In diatribe, it is also a one-way, but it is a competitive. The purpose is to express emotion, browbeat or inspire. Then in two-way, there are dialogue and debate. In dialogue, it is a two-way style and a cooperative style. In this, the purpose is to exchange information and build relationship. It is like a symposium or a panel discussion. In debate, it is a two-way style but competitive. The purpose is to win or convince the opposing. Similarly, in our profession, we generally have either a discourse or a dialogue with our patients. It is not a competition, so hence no competitive type of discussions take place in the clinical scenario. Our aim is to get a cooperative discussion. The aim is to get a dialogue rather than a discourse, because in a discourse the participation of the patient is very less. It becomes a one-way discussion. So a dialogue, which is a two-way discussion, which is purported to increase the information from the patient and build a relationship so you can provide the best of your treatment. So coming to the patient-centric discussion or communication. A patient-centered approach to care is based on three goals: eliciting the patient's perspective on the illness, understanding the patient's psychosocial context, and reaching shared treatment goals based on patient's value. So whenever we see a patient in our OPD or in the clinics, what is our basic aim? Our aim is to provide a best possible treatment and outcome to our patients. So to reach that, it is very important that we understand the patients and the patient's perspective of his or her illness. This can only be achieved by a very properly programmed or channelized or pre-planned discussion, which is called as a patient-centric discussion. In this, we try to extract the patient's idea of his illness or her illness and then correlate it to her psychosocial context and then ask her or ensure that she participates in her diagnosis and treatment planning, which improves the cooperation and the outcome of the patient. So first step is introduction and building rapport. So whenever we see a person, all the person in the meeting should introduce themselves, like the doctor himself, the patient and the relatives of the patient who are in the discussion. In a non-urgent situation, positive remark about non-medical issues such as weather, generalities about the day or non-specific encouraging observation can build rapport. That means you should not directly jump on to what is your problem. Rather, you should give a positive remark. You should break the ice with some common non-medical ground discussions, which helps to build the rapport. The patient or the relatives open up about themselves and they start speaking to you. Once the ice has been broken or the rapport has been built, you can further progress to eliciting the patient's agenda. That is, the patient has come to the doctor for some or the other concern. You should not start directly asking, how are you feeling or how are you today? You should avoid these questions because these questions leads the patient to somatize his or her concern to its physical symptoms. That is, they directly start relating it to their pain or their discomfort. Instead, you should help. How may I start with words such as how may I help you today or what can I do for you today, which brings the purpose to the visit towards the doctor rather than the illness. It is more of a solution oriented approach in the beginning rather than a problem oriented approach. Then when the patient starts speaking, we should list all the agendas of the patient. We should carefully listen to the patient. It is the most important part. We should ask the patient, is there something else, until he or she keeps replying. And when he or she stops replying, we should continue making a list. This list is very useful and the patient also gets encouraged that the doctor is more interested in finding out about all the problems. Then we should negotiate the agendas. Negotiation of agendas means actually we should help the patient to prioritize her agendas or to prioritize her problem list. These phrases are suggested that which of these list, you remember you made a list in the previous slide of the agenda. Out of those, you should ask them to prioritize. You should use such phrases like which of these is the most concerning to you. I would also like to discuss this problem or that problem, whichever agenda you want to address regarding that today. Because we have limited time, whenever you have a limited time, which of this problem would you like to discuss today? Or else you can use the phrases like, I know that this is important to you, but I am more concerned about this. Could we start with this first? So this ensures that the patient feels important and all the concerns of the patient are considered to be very important. But you can direct the discussion towards the priority that you feel needs to be urgent or addressed more immediately, or which is of the more higher concern to the patient. So once we break the ice, then we start eliciting the patient's agendas, then we make the list of the agendas, then we prioritize the agendas. Moving further, we start discussing with the patients regarding on each of their agendas or each of their concerns. So start discussing the patient's concerns with open-ended questions. So open-ended question is a question where the patient is free to answer or use any amount of word or any type of word. A closed-ended questions are the questions where the patient is either able to answer yes or no, or positively or negatively. So in open-ended questions, the patient has the liberty to speak up in their own words. So phrases such as, tell me more about, would you like to talk more about it? I want to know how it started. Tell me what the problem or the agenda was like. What else did you notice? So these questions are probing or they are exploring deeper into the agendas in the patient's own word. The patient may not know that what are the aspects regarding their problem or the agenda which they are supposed to tell to the doctor. Hence, it is our duty to explore more deep into the problems by giving them a open-ended question in the beginning of the discussion itself. Further, ask directed question to elicit details about the chief concern or perform a review of the systems. That means after we have finished asking open-ended questions, we realize that some of the things are more specific and are require a more further, discussion. In such cases, the questions are addressed regarding the duration, severity, location, problem of the problems. Regarding this, the patient has specific answers. So we should note down all these things and the radiation and characteristics of pain, relieving and aggravating factor or any associated symptom. See, the example here is regarding pain. It can be anything else. It can be an injury, it can be a discomfort, it can be any other sign of symptoms. So based on our clinical knowledge, we should be able to extract a more specific details about any of the agenda or the concern and ask the similar closed-ended questions to the patients. So we should elicit the patient's perspective. So then we need to bring, we need to be empathetic towards the patient. So to be empathetic, we should elicit the patient's perspective. It helps us to be empathetic. Empathy is a very important part during a discussion. If the patient realizes or feels that the doctor is empathetic towards their agendas or problems, their level of cooperation is much more and they are more satisfied with the interaction that they do with the doctor. So we should focus on many areas like feelings. So when you are focusing on the feelings of the patient, you can use the phrases such as, how did that or this make you feel emotionally? Tell me more about what was worrying to you. What was your emotion at that time? What would you say is worrying you the most? How do you feel about that? What was that like emotionally? So when these feelings are being extracted, the patient gets an opportunity to express their feelings. So when they are expressing their feelings, they are more prone to bring out a more detailed history or a more detailed expression of their agendas. Then regarding their ideas, the idea of a doctor regarding an illness and the idea of a patient regarding the illness is not the same. So when you explore the ideas, you should be more careful and you should ask that what do they think is the cause of their problem or the agenda or the illness. So do you have any thoughts on what might be causing this? So it helps us to explore the patient's view of the etiology of their problem. This is very helpful as they may miss, these things in the initial open-ended questions. We should also focus on the concerns, impact and expectations of the patient. The concerns regarding what do you worry about regarding your health? Is there something you worry might happen? What are your fears about? So these concerns are actually very important. The patient's illness might not be a big, illness, but the concern or the patient's perspective of the illness might lead to concerns which are irrelevant or beyond requirement. Hence, exploring the concerns of the patients give you a proper insight towards the patient's perspective. See, the patient's perspective has a high impact on their daily life regarding their illness. This impact needs also to be verified. How was your illness affected on your daily life? What difficulties are you facing because of your illness? These factors, the patients are reluctant to tell to you. But once you make a point that you ask about these things, the patients will definitely tell you. This actually helps you to counsel the patients. So the expectations of patients can be reached. Next is to inquire about the expectations. What do you like to get out of today's visit? What more can I do for you today? Is there anything else you need from us today? So meeting the expectations of the patient is very important. But knowing the expectation of the patient is more important. This systematic way of eliciting the patient's perspective helps us to reach from the ideas of the patients, the concerns of the patient towards these required expectations, and which helps us to counsel them more properly. Which all these responses that we elicit, all this perspective of the patients that we inquire helps us to empathize to the patient. So empathizing with the patient is a unique art or the skill that we need to learn. Empathy is a very powerful tool that every doctor should, or powerful skill that every doctor should be empowered with. This empathy will not only help you to counsel the patient, to have a positive rapport with the patient, to improve patient cooperation. It also helps to, have a positive cooperation of the patient during the positive compliance of the patient during the complete treatment procedures. Empathy. The technique of empathizing are as follows. First is naming. You should start, it seems like you are feeling. I wonder if you are feeling. Some people would feel dash in this situation. I can see that it makes you feel. You can, name a feeling. You can sad or in pain or disheartening or startled, or you can use any sort of feeling, happy, sad. You can use the phrase in this term. It seems like you're feeling low today. I wonder if you're feeling low today. So these words helps the patient to express themselves, and it also makes them understand that you empathize with them or you know what they are feeling like. You should not sympathize with the patient, rather we should empathize with the patient. The patient should know that we are aware of what they are feeling. That is empathy. We should not feel what the patient is feeling. Next is understanding. I can understand how you might upset you. I can understand what you would be feeling, or you, given what you are going through today. I can imagine that you would feel like. I can't imagine what you would feel like. I know someone who had a similar experience. It is not easy. This has been a hard time for you. That makes sense to me. All these phrases during the discussion in the prior steps helps the doctor to gain confidence or compliance from the patient while exhibiting the empathy. These phrases of understandings are very helpful in the discussion. Next is respecting. Every patient, when they come to you, are in some or the other problem. They are not feeling good about it. Hence, when you respect, they may feel more comfortable in opening up. They feel more comfortable in expressing their concerns or agendas to you. It must be a lot of stress to deal with. These phrases are very important. I respect your courage to keep a positive attitude in spite of your difficulties. You are a brave person. I am impressed by how well you handled this. It sounds like a lot to deal with. You have been through a lot. You did the right thing by coming in. See, these words encourages the patients by giving them respect. It empowers them to deal with their agendas, to deal with their problem. They gain a positive outlook towards the treatment. Hence, empathy shows to be a more powerful tool in this discussion. Then we should support our patients during the discussion. I want to help you in the any way I can. Please let me know if there is anything I can do to help. I am here to help you in any way I can. I will be with you in these difficult times. I will be with you all the way. These phrases during expressing the treatment plans, expressing the diagnosis, help the patient to be more compliant or be more partnered in the procedure of discussing the treatment, or partnered in deciding the partnered in deciding the treatment plan or arriving at a diagnosis. Supporting the patient is very important. This helps us to have the achieve the third goal of our discussion, that is partnering the patient in arriving at a common goal of treatment. Last is exploring. Tell me more about what you're feeling when you were sick, how you are coping up with this, and what has happened since we last met. See, this is overlapping with the previous exploring point, but this is very important. This is also a way of empathizing with the patient. While you are exploring more about the agendas, it is important that we choose the words more carefully. Else, the patient feels that we are more concerned to know about their agendas or the diseases or the illness or the problem rather than just hurrying up to arrive at the diagnosis or treatment plan. So after we have completed the exploring of the problem or the agendas with the patients, it is the time that we summarize. If you remember the steps of discussion, that was eliciting data, analysis and collection, then comparison and summarizing or conclusion. This is the summarizing phase. So in the summary, you should actually give a brief summary of the complete discussion with the patient, what all you understood. You can start from so far, from what you have told me as so far. You can list out all the problems that the patient have told you, all the feelings that they have told you, all the criteria or specific things that you have noted regarding their illness, which has helped you to conclude the discussion. Let me summarize what we have discussed so far. You have told me a lot of things. Let me say it loud so you know what I have heard. You correctly mentioned me these things. So all these things, they awaken the patient that this discussion is towards the end. And this is the chance where they have to carefully listen whether the doctor has got all the points that are important in the perspective of the patient. Because till the end of the discussion, the patient is more aware and more interested towards expressing his or her concern. So this summary actually is a walkthrough of the patient's agenda or problem that was discussed in the discussion or the appointment. And if anything missed out, the patient has an opportunity here to point out at the same. Then the transition. Transition is the ending of the discussion or concluding the discussion. Diverting. You remember when we started with a more general thing, is to build the rapport. Then we came to more of a problem-oriented or a patient-centered approach where we were discussing regarding the patient and the illness of the patient. We focused more on the patient and his or her feelings or perceptions regarding the illness, moreover than the problem itself, because the problem itself was only discussed during the specific closed-ended questions. In other terms, we are trying to explore the problem and the perspective of the patient regarding the problem and his or her feelings or about it, or his or her views regarding the problem itself. Now we should transit from this more problem oriented or patient centric force to a general thing. We get suggested phrases for the same are. Now I would like to ask you a routine question. These may seem personal or unrelated but are important for us to help. These questions may be related to any previous health issues or any other general condition, or there are any other general habits, or the questions related to a general aspect of patient's routine life. This can further be concluded to collection of additional data like medicines, allergy, history, social family history regarding the illness or the agendas we were discussing. Later, you can include social support network, interests and spiritualities in the same. So that ends the discussion. With end of the discussion, you arrive at a diagnosis and it is the time to reveal your diagnosis or your understanding regarding the disease or the problem that the patient is facing. Now this is a very important part, very important part, that when you break a news, when you reveal the diagnosis to the patient, or when you break a news to the patient, see every news, a patient has got a disease, patient is came to you with some problem and you are going to inform the patient that you are having this disease, you are having diabetes, you are having hypertension. So that is new for the patient. The patient knows that his or her life is going to be changed. They have to follow many things. So that is like a breaking bad news to the patient. Information about death is not the only bad news. Information about any disease or any problem that the patient is going to have to encounter for his life or for a period of his life is very important. It is, it is news that the patient has to tackle properly, positively. Hence, he will be able to comply with the treatment and it will have a better outcome. So, revealing a new diagnosis or breaking bad news is a very important step. So, the areas of focus while breaking a bad news are mentioned here. So we will be, going through the same. The setting, it is a very important part. You should ensure that the privacy of the patient while breaking any discussion or breaking any, bad news or diagnosis is very important. The patient should feel privacy. It is not, patients are not comfortable being disclosed about their illness or about their treatment plan in public area. You should ensure that the patient is comfortable, you should avoid distraction or interruptions, and you should involve significant others, their relatives or guardians or anyone who is accompanying the patient. They should be comfortably sitting down and you should connect with the patient. You should have a proper rapport built up with the patient during the previous discussion. You should have an eye-to-eye contact. You can touch the hand or hold the hand of the patient if it is culturally appropriate in the region. So in this settings, it is more comfortable for the patient to listen to their diagnosis. You should focus on the perception of the patient. You should tell what you already know about your illness and what is your understanding of illness. You should start with the perception of the patient. You should ask the perception also because the patient has a subconscious idea about their illness. They know that it might be diagnosed, it might be diagnosed in such a way. So while breaking the bad news, you should not directly jump to the diagnosis. You should first ask about the perception of the patient regarding their illness or perception of what they feel is the diagnosis or is the outcome. Then you should invite them about the information you would like to receive at that time. Do you prefer to receive the information in stage or all at once? You should ask the patient, what do they want to know? How do they want to know? Shall I tell you the final thing or shall I tell you the complete diagnosis or you want me to give it bit by bit or information by information or step by step? It is a very important method. You can go from a smaller information to a larger information in a incremental step that helps the patient to digest the or to absorb the information more completely. Then you should give knowledge to the patient. You should evaluate and then provide knowledge. Unfortunately, I have some bad news. I am sorry to inform you that. Use words that are familiar to the patient. Avoid medical jargons. You should not use words which are most commonly used among doctors. The patient don't know those terms. So you should use a more common terms. We should not be blunt, excessively blunt or insensitive. Provide information in small chunks and allow time for comprehension. Allow time for the patient to absorb the words that you're telling. Provide them time to understand. Do not take away hope because patients may have other non-medical goals. See, either the patient seeks treatment from you, advice from you, whatever is the outcome, that is the patient's decision, but your work is to maintain hope. You should provide the knowledge to the patient with along with maintaining hope, because hope is a very powerful feeling which helps the patient to comply or positively cooperate with the treatment. Next is emotions and strategies. The patient's emotion. Respond to the patient's emotion with empathy. In the further table, the table above, we have discussed about regarding expressing empathy. The same steps has to be used. Then the strategy that we use should be discussed at the time of giving treatment options. Discuss treatment options if the patient is emotionally ready. To maintain hope of future oriented outlook. You should maintain this strategy. It is overlapping with the previous steps, but we should properly plan regarding having a proper setup. Then in the proper setup, we explore the patient's ideas about the disease and the diagnosis. Then we provide them information in small steps, provide them knowledge in the words that they can be, they can understand. While doing this, we maintain the, we use the phrases that we discussed in the previous slides regarding expressing empathies. And while doing all these things, we discuss the treatment options with the patient. See, this is very important because it maintains hope and the future oriented outlook. That is the positive outcome. The positive approach towards the outcome is maintained by the patients. Then is shared decision making. After expressing or after making the patient aware regarding the diagnosis or outcome of your discussion, it is the time when you discuss regarding the possible or probable treatment outcomes or the treatment options. By discussing treatment options, physician can help the patient make more informed choices. The pros and cons of each option should be outlined, including benefits, risk, potential risk, immediate risk, long-term and adverse effects or complication, and cost, direct and indirect costs. All this should be calmly explained to the patients. The options of no active treatment with follow-up, watchful waiting, or wait and watch may also be discussed if it is an option. Providing options reaffirms the patient's need to be actively involved in his or her medical care. This empowers the patients to choose wisely for himself, to make a decision, to make a more informed decision. This empowers the patients because they feel they are they are participating in the decision making of their own health, which is very important for them. And you can encourage them to take the right decision, but you should not direct them towards what is your perceived treatment plan. It should be the decision of the patient. You should give all the positive and the negative pros and the cons regarding the treatment idea to the patient. However, the patient should not be overburdened with extensive information. A balanced approach involves asking about patient's previous knowledge of the illness, then providing small chunks of knowledge, as we did in the part where we were breaking the bad news. Even during making the decision of the treatment outcome, treatment options, the same principle can be used. You should provide the information in small chunks and check whether the patient is understanding that, and then further progress to the further steps of the treatment options. The patient's values, goals should be explored. If the patient is unable to make decision based on the medical information alone, every patient will not be able to understand or will not be able to comprehend the medical information we provide. Hence, we should focus also on the patient's values and goals. They help the patient to become the part of the treatment option decision. Patient's clinical condition, health literacy, emotional state, and complexity of the medical decision may necessitate multiple sessions with the physician. That means every patient may not be able, or every problem will not be so simple that the patient and doctor will be able to derive the diagnosis and the decision of treatment options in a single setting. They may require multiple sessions with the patient and the physician to decide on a treatment plan. Shared decision making can be supported by printed aid that visually depict clinical risk using pictographs. That means you can provide us in a single session, you can do a part of the discussion and you can provide some data or some written or pictographic materials which help the patient to understand his or her illness or problem or agenda or concern and get more equipped with more knowledge regarding the same and the treatment option, which helps them to take a decision, to take a more aware, informed decision. This is very important, as once the patient is partnered or once the patient feels that he has shared in decision making, the compliance improves. So in conclusion of today's topic, a patient-centric communication may not improve the outcome of the treatment, but it helps the doctor to treat the patient and not the disease. Treating the patient comprehensively and not the illness is our goal. Proper discussion and communication with the patient is a key factor to arrive at the best diagnosis and devise the optimal treatment plan in cooperation with the patients, leading to a better compliance by patient. Respectful, empathetic, non-judgmental, non-threatening communication with the patient is a skill which needs to be learned and practiced routinely. Thank you very much. Thank you for listening. If you have any questions, you can ask in our question answer session or on the online Google platform. Thank you.